Nurse Aide Practice Test NC. Question 1. A client who is dying expresses a desire to talk about their life and experiences. The nurse aide should: Option A. Redirect the conversation to something more pleasant. Option B. Provide active listening and allow the client to talk. Option C. Tell the client not to worry. Option D. Change the subject to the client's care. The correct answer is option B. Provide active listening and allow the client to talk. Life review is an important part of the end-of-life process. Active listening validates the client's experiences and supports their emotional needs. Redirecting or dismissing denies them this important processing opportunity. Question 2. A dying client requests to see their pastor. The nurse aide should: Option A. Tell the client the pastor is busy. Option B. Contact the facility chaplain. Option C. Change the subject. Option D. Tell the client to pray alone. The correct answer is option B. Contact the facility chaplain. Spiritual support is important at the end of life. The nurse aide should contact the chaplain or the client's clergy. Dismissing the request is inappropriate. Changing the subject avoids the client's needs. Question 3. The nurse aide notes a reddened area on a client's sacrum that does not blanch, turn white, when pressed. The aide should: Option A. Document it and turn the client. Option B. Massage the area to increase circulation. Option C. Apply heat to the area. Option D. Leave it alone. The correct answer is option A. Document it and turn the client. A non-blanchable reddened area is a stage 1 pressure ulcer requiring immediate documentation and repositioning. Massage is contraindicated. Heat is not indicated. Question 4. A client's temperature is 101.2 degrees Fahrenheit. The nurse aide should: Option A. Document the temperature. Option B. Report it to the nurse immediately. Option C. Give the client a cold bath. Option D. Retake it in 1 hour. The correct answer is option B. Report it to the nurse immediately. A temperature of 101.2 degrees Fahrenheit is a fever requiring immediate reporting to the nurse as it may indicate infection or other medical conditions. While documentation is important, reporting is the priority. CNAs cannot initiate cold baths without nursing orders. Retaking in 1 hour delays necessary intervention. Question 5. When performing chest compressions on an adult, the nurse aide should compress the chest to a depth of: Option A. 1 inch. Option B. At least 2 inches but no more than 2.4 inches. Option C. 3 inches. Option D. 4 inches. The correct answer is option B. At least 2 inches but no more than 2.4 inches. Adult chest compressions should be at least 2 inches deep but no more than 2.4 inches. 1 inch is too shallow. 3 to 4 inches may cause injury. Question 6. Restorative care focuses on: Option A. Curing the disease. Option B. Maintaining and improving function. Option C. Providing end-of-life care. Option D. Replacing the client's abilities. The correct answer is option B. Maintaining and improving function. Restorative care aims to maintain and improve the client's functional abilities, promoting independence and quality of life. It is not focused on curing disease or replacing abilities. Question 7. When providing care for a client from a different culture, the nurse aide should: Option A. Follow standard procedures regardless of culture. Option B. Ask the client about their preferences and respect them. Option C. Assume cultural preferences based on the client's appearance. Option D. Ask the nurse to provide care instead. The correct answer is option B. Ask the client about their preferences and respect them. Asking the client about their cultural preferences shows respect and enables culturally competent care. Following standard procedures without regard for culture may be insensitive. Making assumptions based on appearance can lead to stereotypes. Question 8. A client with mental health issues is withdrawn and refuses to speak. The nurse aide should: Option A. Talk to the client regardless of response. Option B. Sit quietly with the client. Option C. Leave the client alone. Option D. Ask personal questions. The correct answer is option B. Sit quietly with the client. Silent presence is therapeutic for withdrawn clients, who may not feel like talking but still benefit from companionship. Talking without response may be perceived as pressure. Personal questions may be intrusive. Question 9. Normal adult respiratory rate is: option A, 8 to 12 breaths per minute. Option B, 12 to 20 breaths per minute. Option C, 16 to 24 breaths per minute. Option D, 20 to 28 breaths per minute. The correct answer is option B, 12 to 20 breaths per minute. The normal adult respiratory rate is 12 to 20 breaths per minute. Rates below 12 indicate bradypnea, above 20 indicate tachypnea. Both require reporting to the nurse. Question 10. A client with depression refuses to get out of bed. The nurse aide should: option A, allow the client to stay in bed. Option B, gently encourage the client to get up. Option C, force the client to get up. Option D, call the family to get them up. The correct answer is option B. Gently encourage the client to get up. Gentle encouragement with support and assistance can help the client participate in care. Allowing them to stay in bed may worsen depression. Forcing them is not appropriate. Family members should not be expected to manage care. Question 11. When weighing a client, the nurse aide should: option A, weigh the client at different times each day. Option B, weigh the client at the same time each day. Option C, weigh the client after meals. Option D, weigh the client before toileting. The correct answer is option B. Weigh the client at the same time each day. Weighing at the same time each day, example, before breakfast, provides consistent, accurate monitoring. Different times, after meals, or before toileting can cause variations. Question 12. A client is pacing and appears anxious. The nurse aide should: option A, ask the client to sit down. Option B, walk with the client. Option C, give the client a sedative. Option D, leave the client alone. The correct answer is option B, walk with the client. Walking with the client provides exercise, reduces anxiety, and allows the aide to monitor for safety. Asking them to sit down may increase anxiety. Sedatives require an order. Leaving them alone may be unsafe. Question 13. The nurse aide should document care. Option A, at the end of the shift. Option B, as soon as it is completed. Option C, before providing care. Option D, only if the client's condition changes. The correct answer is option B, as soon as it is completed. Documentation should occur as soon as possible to ensure accuracy and prevent forgetting details. Delaying to the end of the shift may lead to memory errors. Question 14. In the event of a fire, the nurse aide's priority is to: option A, extinguish the fire. Option B, rescue clients from the immediate danger area. Option C, call the fire department. Option D, save the client's belongings. The correct answer is option B, rescue clients from the immediate danger area. The priority is to rescue clients in immediate danger: race, rescue, alarm, contain, extinguish. Extinguishing the fire, calling the fire department, and saving belongings are secondary to client safety. Question 15. Normal adult resting heart rate range is: option A, 40 to 60 beats per minute. Option B, 60 to 100 beats per minute. Option C, 80 to 120 beats per minute. Option D, 100 to 140 beats per minute. The correct answer is option B, 60 to 100 beats per minute. The normal resting heart rate for adults is 60 to 100 beats per minute. Rates below 60 may be normal for athletes but are considered bradycardia. Rates above 100 are tachycardia and require reporting. The other ranges are outside the normal adult parameters. Question 16. Which is a violation of HIPAA? Option A, discussing client care with the client's family who is present. Option B, discussing client information in the elevator with another aide. Option C, documenting care in the client's chart. Option D, reporting client information to the nurse. The correct answer is option B. Discussing client information in the elevator with another aide. Discussing client information in public areas, elevators, cafeterias, hallways, violates HIPAA because conversations can be overheard. Discussing with family present, documenting, and reporting to the nurse are HIPAA compliant. Question 17. The best way to communicate with an unresponsive client is to: Option A. Avoid talking to them since they can't hear. Option B. Speak to them as if they can hear and respond. Option C. Speak loudly near their ears. Option D. Only speak to family members. The correct answer is option B. Speak to them as if they can hear and respond. Many unresponsive clients can still hear and may benefit from hearing familiar voices. Speak calmly, explain procedures, and use the client's name. Hearing is the last sense to go. Question 18. The nurse aide is performing perineal care on a female client. The aide should: Option A. Wipe from front to back. Option B. Wipe from back to front. Option C. Wipe in circular motions. Option D. Wipe in any direction. The correct answer is option A. Wipe from front to back. For females, wipe front to back, vagina to rectum, to prevent introducing fecal bacteria into the urethra or vagina. Back to front increases infection risk. Question 19. A client's blood pressure reading is significantly different from the previous reading. The nurse aide should: Option A. Ignore the difference. Option B. Recheck it after 1 to 2 minutes. Option C. Change the client's medication. Option D. Document the first reading only. The correct answer is option B. Recheck it after 1 to 2 minutes. When an unexpected reading is obtained, recheck after 1 to 2 minutes. The client may have been talking, anxious, or the cuff may have been positioned incorrectly. CNAs cannot change medications. Documenting only the first reading without confirming would be clinically incorrect. Question 20. Which sign indicates a client may need toileting assistance? Option A. Restlessness and picking at the sheets. Option B. Closed eyes and slow breathing. Option C. Smiling and laughing. Option D. Sitting quietly in bed. The correct answer is option A. Restlessness and picking at the sheets. Restlessness or agitation often indicates a need to use the bathroom, especially in clients who cannot verbally express this need. Offer toileting regularly. Question 21. When a nurse aide is floating to a different unit, they should: Option A. Refuse to float to an unfamiliar unit. Option B. Accept the assignment but only do familiar tasks. Option C. Accept the assignment and ask for orientation to the unit. Option D. Accept the assignment and perform all tasks independently. The correct answer is option C. Accept the assignment and ask for orientation to the unit. Floating is normal, but the aide should request orientation to the new unit. Refusing may be insubordination. Doing only familiar tasks may not meet client needs. Question 22. What is the correct order for putting on personal protective equipment, PPE? Option A. Gloves, gown, mask, goggles. Option B. Gown, mask, goggles, gloves. Option C. Mask, gloves, gown, goggles. Option D. Goggles, gloves, mask, gown. The correct answer is option B. Gown, mask, goggles, gloves. The correct sequence is gown first, then mask, goggles/face shield, and gloves last. Gloves are most likely to become contaminated and are removed first during doffing. Question 23. A client with dementia has incontinence. The nurse aide should: Option A. Place the client in adult briefs without offering toileting. Option B. Offer toileting at regular intervals. Option C. Restrict fluids to reduce incontinence. Option D. Ignore the issue. The correct answer is option B. Offer toileting at regular intervals. Regular toileting maintains dignity and may prevent incontinence. Restricting fluids can cause dehydration. Ignoring the issue is neglect. Briefs may be necessary but should not replace toileting. Question 24. The nurse aide's role in rehabilitation includes: Option A. Performing all ADLS for the client to save time. Option B, encouraging the client to perform ADLS independently. Option C, telling the client they cannot do anything. Option D, leaving the client alone to figure it out. The correct answer is option B, encouraging the client to perform ADLS independently. The nurse aide's role in rehabilitation is to encourage and assist clients in performing ADLS independently to restore or maintain function. Doing everything hinders progress. Question 25. The nurse aide's responsibility with advanced directives includes: Option A, helping the client complete advanced directives. Option B, honoring the client's wishes and informing the nurse. Option C, making decisions for the client. Option D, explaining advanced directives to the family. The correct answer is option B, honoring the client's wishes and informing the nurse. The nurse aide must respect and follow advanced directives and inform the nurse of any issues. The aide does not assist in completing advanced directives, make decisions for the client, or explain legal documents to the family.